On today's episode of Dance Med Spotlight, I'm talking with Jenna Kantor. She's a private practice performing arts physical therapist based out of Pennsylvania and New York. She has a background as a dancer and professional musical theater performer. She is the owner and founder of the Dance PT program, where she offers CEUs and a certification for PTs, PTAs, or PTA students who are interested in pursuing dance physical therapy. In this episode, we talk about a lot of different topics, not only the program that she offers and how she works with her clients, but we also talk about burnout and how to embrace your true authentic self as a therapist working with your clients. A lot of different topics that were really fun to talk about. So be sure to check out this episode. Welcome back to another episode of Dance Med Spotlight, where we talk about all things dance medicine. My guest today is none other than the lovely Jenna Kantor. Welcome, Jenna.
Hello, thank you for having me.
So for people watching this episode or listening to this episode, it's probably going to feel a little different than some of my other ones, just because Jenna and I know each other very well. We've known each other for gosh, I don't even know how many years now. But you were actually one of the first people that I personally got to know who was in the dance medicine world and was like, yes, I work with dancers specifically. And it's like, oh, I guess that is a thing. And it's not just me going, that seems like a cool idea, but nobody does it. So that's how we know each other and got connected in the first place.
And it really grew, our friendship grew organically. It was not a force. It was really just natural, gradual, like, yeah. And I love it when it happens like that. You never know. You never know who's going to be your good friend. Aha.
Yes, exactly. So, for people who don't know you as well as I do, tell us a little bit about who you are and some of your background getting you to where you're at this point in your career.
Yes, I'm a performer and physical therapist. I grew up as a ballerina. Ballet is the air I breathe. That is something I heard my ballet director say growing up my whole life. And so I learned to make that in general, the stage and performing is the air I breathe. I treat dancers. I still currently am a performer. I ended up, oh gosh, I've been interviewed about this a lot, but I'll sum it real fast. I had a history of an eating disorder, which led me to not knowing where to go with my life, even though I still knew I loved performing. And oh gosh, wow, it's really hard to like skip over stuff. But and I went ended up going to physical therapy school, which was actually a nightmare come true to me because I considered that a failure as a musical theater performer. Let me rewind. So I went to school. I went to college for dance and drama, which that to me was like, because I always wanted to be a ballerina, but then I ended up with injuries that got in the way. While I was in college, I found musical theater. Then I went on to have the musical theater career. While doing the musical theater career, eating disorder, lots of traumatic things to deal with, in which I started to look at what's a way to have a survivor job that is not catering or working with food, because I didn't feel with an eating disorder that was a good environment for me. And then my parents were pushing me towards physical therapy, which they said when I was a little kid too, because they both, like, oh, your dad's a dentist, you got to do something, the medical, whatever. I ended up thinking, okay, they're obsessed with the body, so it will never be as good as performing, but sure, let's do it. And I went in embarrassed. I didn't even share on social media. I like hid it from the Musical Theater Society because I was performing professionally at that point. I hid it from the Musical Theater Society while other people were posting first day of school. I was like, boom, I got job offers like as a performer. And I was like hesitant to say no because I didn't want anyone to know I was like getting my doctorate. I was embarrassed because I felt like a failure. While I was there, that's when I discovered the gift of giving. And I never understood that because as a performer, you always have to take in order to get anywhere. And I learned how giving is way better than receiving. That wow, it's oh my God, yeah. If you know, you know. I'm not. You're not. I'm not saying it to sound benevolent. La, 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 la. I remember when I was in interviews for schools and kids were asking, "Oh, like what are the volunteer opportunities?" And I was like, "Huh? These brown nosers. What are they talking about?" But when I was in school, I learned the beauty of it. Oh, it's so
Mhm.
rewarding, and then when I finished school, I already was very connected in the musical theater industry and the dancers because I was doing it professionally. So it wasn't like it happened overnight because we're talking about quite a few years of performing professionally and to have those connections. And so I was working with performers in New York right away, which was great. And then I ended up in Pittsburgh because, like the pandemic happens and and the areas you were thinking of moving to become very solid very fast when you're socially not even drained, you're in a social drought. Yes,
Mhm.
yes. So here
Mhm.
in Pittsburgh, I still am licensed in New York, and then goodness, and also treat in Pittsburgh, Pennsylvania in general. And then I started, and then now, segue, which is why you see the Dance PT program. I still treat, but the creation of the Dance PT program really came about me loving knowing other Dance PTs. I always wanted to have a party and hang out with other Dance PTs. And from doing some posts in the Doctor of Physical Therapy group, I was just asking because I was trying to find other Dance PTs.
Yeah.
Someone in there was like, "You need to start a Facebook group," and I was like, I didn't want to, but when that I was asked, I was like, well, I had mentors at the time, Alex Engar and Will Boyd, and they were pushing for me to start something. I was like, I don't want to teach. This is me. I never thought I'd be a physical therapist. Wow. I don't want to teach. Start the group. And I'm like, okay, let's beta test this. Let's see if I like it. Loved it. And now I've been doing it for, what is this now? I don't know when this will be published, but in no 2023. So I've been doing it for 4 years. And
Mhm.
students get certified to be a dance PT. And that's not just like you know your stuff when you finish with me. And that's developed over time more and more. There's a reason why the
Yeah.
price was super cheap at the beginning and then it went up because like I'm good. I feel very confident. And the people who work with me very confident on treating all dancers and then exactly what to do to get dancers in the door. So you get CEUs and a dance PT certification. And yeah, so I do a couple things.
Yeah,
Treating dancers,
you
and
know.
I'm not going to talk about the other things because Alyssa knows. Just stop there. Focusing on dancers.
Well, and I find that I don't know, I think a lot of physical therapists that are in private practice, like, we tend to dip our fingers in a lot of different things, but I feel like the people that I've gotten to meet within the dance medicine private practice space, it's a whole 'nother level because I don't know why, but it's just
Are we
everyone is
really? A
super
lot of these are
involved.
like, "Boo, boo, 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 boo," we get into it, huh? Yeah.
Mhm.
I think
Most
it's when we're
definitely.
so passionate. I think it's just it's a we always wanna think of how we can get more involved. It's never enough. Yeah,
Yes.
yeah.
Yes, we get obsessed, that's for sure, in the best way possible. So before we talk more about your dance PT program, one thing I want you to share a little bit about is maybe about your private practice, because I think compared to a lot of private practices that we might think of, your format and things that you offer for dancers or performers is definitely a little different.
Uh, oh, because of the wellness? Is that
Well,
why?
because you do the wellness stuff, you do a lot more virtual stuff, like,
Oh,
it's
yeah.
not your typical, like, in the clinic or backstage type
Well,
stuff.
okay. So the virtual stuff exploding for me happened because of the pandemic, as you know, God, what a devastating time for all of us. And I pushed. I was doing virtual stuff visits, and then I saw very quickly my patients were getting better faster virtually, and I went back to the evidence, and I'm actually diving deeper in that to do an Oxford debate on manual therapy versus exercise, as you know,
Mhm.
with a very dear friend of mine, and I really learned firsthand. Hold on, cat. Come on in. My cat wants to be here. Come on in, Ani. Ani's going to share. Ani agrees. He said he just told me he approves on what we're discussing so far.
Perfect.
Yeah, perfect. So they were getting better faster. I then developed, I call it wellness because in physical therapy, it's often acute. I think of how insurance thinks. Insurance goes, oh, look, they can walk 10 feet to go to the bathroom and to work. They're healed. And we're like, would they need to drop from the ceiling and land in the splits or, do a tour jeté into a backflip? How would that happen? I think it could. That would be hard. It's just like evaluate.
Interesting.
But you follow.
Yeah.
So, or like fouettes into a split leap and landing down into a somersault. Yeah, that's a thing. I don't want to do it, but somebody could. So we have to do these way higher levels. And so insurance doesn't cover. So that's where I say we're in the wellness world, where we now start having to prescribe and exercises that are going to work them to a much more functional level Ani wants to be on. Hi, this is my cat, Ani. Attention right now. Eventually he'll be asking to leave the room. And goodness. So that's where I have soared virtually. Then fast forward just in 2022, the end of 2022, Alyssa knows this. I had a oh no moment. It's such a oh crap moment where I realized it wasn't realized. It was very, very clear that people didn't want virtual. They want it in person. I was like, dang it, I haven't had to try while I've been in Pittsburgh. So it's essentially starting all over again with my practice. I'm like, okay. So when diving into that, I did all the in-person, I basically applied what I teach and it works. And, but people still want virtual though. Like they want in person, but then they're happy with virtual because of the convenience. I also do very strongly believe there is a point which does align with insurance, where the dancers are just coming in and just doing their exercises and going, and you're kind of just checking up. I mean, yes, you have to do the re-eval, blah, 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 all that stuff, but like it is that. And while they're doing the exercises, just for you to watch and see, we're automatically evaluating it. Like, so I provide lower prices where they're coming in, and honestly, it's very much hanging out on there, but it's also accessible because there are not accessible prices out there for these dancers. And so they get to work with me and they're doing their exercises. And yeah, moving forward, I had one dancer, unfortunately, who was doing a summer intensive, dance intensive, and got in a car accident. And we had to go on pause for a little bit. And that's like the flip of going from wellness to physical therapy back to wellness. And with the car accident, this dancer was very lucky to not really have any significant traumatic things go on in the body. So it's more just waiting for the body to calm down, if anything, and the anxiety that comes from that too, big time. But yeah, so having that capability to switch and go back in person if I need to do that visit, to check up the body. All those options are there depending on what they can afford, but they don't suddenly get completely cut off. So I've really played with a lot of virtual because and also, I mean, gas money, there's a lot of things that are really fast if you're offering lower prices. So the virtual really, really helps out with that big time. So I think that's what you were getting at, where I'm different. I play around with a lot of wellness, but I've heard that there are also large physical therapy chains. I don't know names of them off the hand, where they're like, oh yeah, we do very well with wellness. Like, I think every practice could use that, which is good. Yes.
Yeah, definitely. And I know that's something that I've included in my practice where, it can be this really interesting flow, like you were talking about, where like maybe something happens and now they're more acute again and truly in that like physical therapy space of what we think of more traditionally as PT. And so, I have people who come to me with that acute need first off, and then that gets better, but then they want to go wellness route and really work on, well, now how do I take it to another level, work on performance, work on prevention, all of that kind of stuff. And then maybe something else happens and we go back onto the acute side. But, it's nice being able to take them through the entire journey and not just go, well, your knee's not bugging you anymore. Okay, bye.
Yeah.
Let me know when something else bugs you.
And that also gets in the way of their profession, what the things that they need to do, ability wise. So that they start to
Mhm.
make all these do all these compensations, as we know, as PTs, do all these physical compensations, and they think they're just stuck like that for the rest of their life. And honestly,
Mhm.
they may if they're doing it for so long. It might be a
Right.
pretty hard thing to break them out of, whatever that is. Ani
Mhm.
really wants to say so much. I do also want to say where my practice is definitely very different. I'm very big on being myself the whole time, my personality, my energy. I absolutely support being that who they are. And honestly, that really does fit in with my musical theater people big time,
Mhm.
because when I am myself, feel that my patients feel and my students feel more comfortable to be themselves, however that may be.
Yeah.
There are all different types of personalities, and there are different personalities that work well with personalities. Can I mold myself? Yes, but it's like talking like a dead person. I cannot do that. It's something's dead inside of me when I turn on the or off or whatever me who I am. And we don't ask that
Mhm.
of introverts.
Yep.
So I just think it's a very you're like I have so
Me.
many friends who are introverts. It's hilarious. Uh,
Mhm.
but we don't. I get in many cases very angry at times when I hear of somebody getting picked on for being too happy or bubbly in a situation. I think that is um, that's not good, because for there are people where that's actually a safer space. It's
Mhm.
a safer space for them.
Mhm.
Uh,
Definitely.
yeah. Anyway, so that's a big thing that I push for, is people feeling comfortable to be their authentic self, however that is, so that way they can just be their happiest person while
Mhm.
patient.
Mhm.
Of course, it's still respecting boundaries with people. All that's
Right.
still, yeah.
Right. But you don't have to, like, have fit the mold of what a PT is supposed to look like or
And that was
whatever.
by whoever, because like
Yeah.
I call it the khaki pants polo shirt personality. And I have some students that I've
Yes.
worked with that have that. They have that, and we've talked about them. Like, oh, you got the you can. They're like, yes, I definitely. They know exactly what I'm talking about. They're like, oh yeah, yeah,
Mhm.
yeah, I can totally do that. But they still have had problems. Some of them with employment and being treated horribly. It doesn't
Mhm.
matter. It
Mhm.
doesn't matter.
Right.
There's so many different reasons why it will potentially not be the right fit where you're working. Or with the patient, it's not just changing that. If there, that's not the quick fix.
Yes.
You know?
Yes. And I think that leads really well to another thing that I wanted to mention as we're chatting here today. So, kind of thinking about as a PT, things that, like you were talking about, sort of having to mask and fit the mold to be employed somewhere. Or, like the last place I worked at full time, it was a place where the business model was the epitome of the mill, where we were cranking through patients every day. And I knew I could do more for my patients, but the business model wasn't going to allow it.
Oh,
And I ended up in such a bad place working there and so burnt out. I ended up giving my 2 weeks notice. They managed to negotiate a few extra days out of that. I think we did 3 weeks. And then I didn't work in the clinic for like 3 months. I quit without a job, and that's where I really started picking up some of my teaching role at the PT program. But, I was just at this spot where it was like, I am so burnt out right now. I don't care if I don't have a job. I need to figure myself out and figure out what I want to do with myself. And eventually, once I built up funds and came up with my idea and that kind of stuff, I opened my own private practice. But that burnout thing was a real thing. And it is all too common with people, not just in PT, I mean, any profession, but we see it a lot within our profession. And I think sometimes, especially when it's people like us who are passionate about working with a really specific group or in a really specific niche, when we're not in that before, it's like, something's missing and I don't know what. And then we find like, ooh, I can do this thing that I'm excited about. And then there goes the burnout problem.
oh yeah, big time. And yeah, I didn't know the details of that, so I'm actually really happy to learn that new thing about you.
Yeah.
And because I know you've been, I know you've been through some stuff. I mean, unfortunately, who hasn't? Um,
Mhm.
and with that, I remember when we first met, I already thought when we first met, weren't you already like working with dancers, or you were like building it more? Were you building?
Well, so when I first opened my practice, I was just like a general PT clinic trying to market to everybody. And
Oh
then
yeah,
I was like, well, I really want to do dance, but that's going to be like a subsection. And so at one point, I was doing like general PT, dance, and work comp. And then eventually funneled and like I'm just going to focus on dance, and if other people show up, sweet. I like working with whomever wants to work with me, but I'm really going to focus my marketing and efforts on the dance community.
I love that. I love that. Yeah, yeah, and it was very cool. Oh, for those who I love to always brag because you just do so well. Alyssa is an alumni from the Dance PT program as well, and that was very cool. And also, where our friendship grew kind of organically, then like closer, 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 closer kind of thing.
Mhm.
And so I love all that you do. Alyssa's a perfect example. I love that it's not about you, this podcast, but I'm totally making it about you. But whatever, I love you. No, but Alyssa has done such a good job with putting it into action. Things don't just appear. It takes action, it takes consistency. You're going to have roadblocks along the way as you're pursuing and making it happen for yourself. Do you need me, a mentor, to make it happen? Absolutely not. Do a lot of people need it? Yes, because having a mentor makes a world of a difference. Could you imagine studying to become a physical therapist without school? Oh my God, no way, no way. Even if school
Mhm.
wasn't a thing, I'd be like, yeah. So yeah, you really are good at whatever you take, whatever you learn, just like boom, 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 going and doing it. Yeah, the proof is in the results, which is good. And it doesn't happen overnight. Did it happen
Nope.
overnight?
Heck no.
Absolutely
I
not. It
wish.
did not happen overnight. And I was mean to myself. I came from a place where I was very established in New York and moved to a place where I didn't know anyone. Are things working out?
Mhm.
Yes, but like it sucked when I finally had to put in the work. I was like,
Yeah.
let's do
Yeah,
it.
and that's the thing, like, when I opened my practice, I had been out of full-time PT work for
We're
probably about
I just wanted to leave. All right.
oh, yes.
Good. Me
I
too.
was out of full-time PT work probably, I don't know, at least 4 or 5 years, if not more than that,
Yeah.
and I was doing PRN all of that time, and I had gone from having all of these great connections from, like, physicians and different people like that, and even some of my patients who were connected to other people in the community that I had really good rapport with and really good relationships with. When I left, all of that stuff went away, and so years later, when I decided to open my private practice, I was starting over again. Even though I was in the area that I've lived in my whole life, I had no connections to work off of anymore. And there's a part of me where it's like, "Ugh, I wish I would have been in a place back then to start right away so that I could have leveraged some of those connections." I might have had a little different journey and path through everything, but at the same time, through all the other things that I experienced, I learned a lot. It wasn't always the easiest thing, but like working PRN at all of those other clinics, I got exposed to a lot of other business models and, just ways that things worked within the clinic. And it was like, I like this. I don't like that. Okay, when I open my thing, I'm going to keep this in mind. And so, all of those were learning opportunities to put into play later when I was ready to do something with it.
Right. 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 Yeah. I love it. I love it. Yeah, and it works out. It's slowly but surely it works out. It's slowly but surely. But just don't give up. Yeah,
Yeah.
I've run into so many people at different places, either students or professionals, new professionals, people who've been working for a very long time. The way we can get in our way with pursuing the profession of treating dancers, focusing on that niche is like unbelievable. I speak publicly and on social media interviews often, most of the time talking about how we get in our own way because it's the
Mhm.
biggest problem. It's the biggest problem. And anybody who's a naysayer, even if they're nice to you, but if they're saying like, ooh, can I go into the naysaying thing? Oh my God.
Go for it.
Yes. Okay. This will not be the first time I've talked about this, but I think it's important to identify naysayers on your journey. So naysayers can come about in different ways. I'm going to give one story that I've told multiple times. I had one student, actually, this person wasn't a student with me yet. They were not working with me yet when this happened. They went to CSM, which is Combined Sections Meeting it's a big physical therapy conference. And there is a group, a small group, a performing arts special interest group that's part of the American Physical Therapy Association. And so they were doing a meetup with Dance PTs. Amazing. And they were at this. I wasn't able to be at it because I swear this was an innocent thing this year. But I wasn't able to be it because I had planned a Dance PT meetup, but I didn't know about their meetup. So like there was a bit of an overlap. That was a bummer because yeah. But anyhow, this person went to that and met up at my thing as well. And because yes, going to all the things, absolutely.
Mm-hmm.
And they were there, and there was a practitioner, somebody very reputable up the chain, has been working in Dance PT for a long time. So this new grad goes up to the pro. Let's make up names. So Sonia, sure. I love this. Sonia is going to be the new grad, and Tennille is going to be the long-term professional. Sonia and Tennille. I don't know. I'm just like
amazing. Love it.
So Sonia, she goes up to Tennille, super excited, says, "Oh yes, I cannot wait. I'm going to be I plan to go ahead and treat dancers. I'm going to start my own practice. I'm really excited. It's just like I'm just getting things together for that." And Tennille looks and goes, "Oh, really? You know, what kind of practice?" Oh, and Sonia says, "Oh, it's going to be Cash PT. I can't wait. Out of network." And Tennille looks at Sonia, who's so excited to be talking to somebody who's been working in the industry for a long time. So it's great to be sharing this dream that's in the process of just about to take action. And Tennille looks and says, "Okay." And I don't care the tone. You can make this friendly. You can make this mean. Okay. So clearly I don't approve. Okay. For the record, there's already a like, on my side. So Tennille says, "Oh, how are you going to make your practice accessible to all dancers?" And Sonia's, I don't know what Sonia said. She didn't remember when she was telling me about this. And when she told me this story, she wasn't saying that she was getting naysayed in it. She was saying it because she felt like there was something wrong with her. And when I was told this story, I was like, how dare Tennille? How dare she, this person who's been around for so long? That is like the highest, craftiest, most conniving a method of cover up professionalism. Perfect example where they're being nice, but absolutely like catty and judgy, and throwing this innocent, excited, motivated human into a brick wall with something they're very excited about. This is what Tennille could have said if she wasn't, so busy judging and naysaying. She could have said, "Oh, I don't know anything about this because I don't have a background. That you might be concerned on how you can be accessible. Here are some friends to talk to." Not sit there and watch the person. I'm livid. That is high. That is, and that's where naysaying can be absolutely hidden. It happened to me one time, but it wasn't in direct it was kind of in my actions. I was doing this campaign, and for those who know me, I'm not the traditional personality in the medical field, and I refuse to ever be. Do I remain HIPAA compliant? Absolutely. So anyhow, I was at a conference, a physical therapy conference, one where like it's pretty much the people who go are the people at the top level amongst the American Physical Therapy Association. These are like the people, the creme de la crop. So to be amongst these, very, very cool. And so everything that's discussed at this particular conference is people cannot say, people can talk about what was discussed, but they can't say who said it. It's very, in a way, HIPAA compliant. So somebody was talking about physical therapy and set aside a little side thing, because physical therapy is not sexy. And I'm sitting by a bunch of friends and I was like, want to bet? So I created a campaign. Visit PT is sexy. And I went around and everybody got it. I went around and I was showing the PT is sexy to like big names in the industry. And I'm being kind, not saying the names, even though that wasn't what was discussed. This is an absolutely sidebar. I created this whole campaign. One good friend was really helpful and kept making sure that I was giving diversity in representation. So I started off with the stereotypical beautiful models, but then the campaign and then from people with different skin tones, different from different areas, and then different ages, people who had an amputated leg. It just massive variety, and it more and more and more and more and more, and it just only said PT is sexy. That's it. I had nothing to sell, and so I was doing this. Because was this a weekly thing? I think I made it 54. What I do is there's 52 weeks in a year, but I always make 54 because you never know if I'm posting on Thursday, if there's more Thursdays that year. So I was doing, I think I was posting one a week. And okay. So that's what I'm doing there. Now, let's go to another thing. There's a person that I really looked up to. Let's call her Megan, okay? And I was a new grad, and when I graduated, I was like, "Ooh, I want to start becoming friends with these dance PTs I've met." So this Megan was one of those people. I was messaging, not too much, because I didn't want to, I can be a lot. I mean, even when I don't try, I'm a lot, so it's fine. It is what it is. But once people get to know me, they love me. It's fine. So I'm messaging Megan, really, really excited about getting to know her. Didn't hear anything. I didn't read into that at all. Megan's probably busy. I saw Megan moved into a job opportunity. I messaged her, "Oh my God, congratulations," all these things. I didn't hear from her. I even saw her at a conference and, hi, good to see you. I didn't even bring that up. I'm going, it's fine. Well, I'm doing the PT is Sexy campaign. And there's several things that I learned so much from this campaign. I could do a whole, I would need to be guided on how I just talk about it because I am a white female. So I've been doing it for at least like 3 months now. And I've put up beautiful models like in this, of all different sizes, blah, blah, blah. And I guess it was my first one of a black male with his shirt off. Oh, gorgeous, gorgeous, like the washboard abs, beautiful. PT is sexy. And I have never gotten, I got the most reactions from this one out of all the people I did before. Gorgeous, beautiful. This one got the most reactions. And that's when I first hear from Megan. And Megan messages me, "Are you sure you want to be doing this PT is sexy campaign thing?" And this isn't a new argument, what she said. "Are you sure this is appropriate?" Blah, 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 all that kind of stuff. And I said, "Oh, I would love to connect with you to talk about it." And I happened to be doing work with a mentor at the time it was all about connecting with what was really going on within me in my life. To be connected to my true story, how to be in my best self, happiest, all that stuff. And so she's messaging me, and I'm not hearing back from her. I didn't hear back from her to connect. And I was like, "Oh, okay." Then fast forward, I kept doing it weekly. This PT is sexy, geriatric individuals, whatever, PT is sexy. And I hear from her again, saying essentially the same thing. "Yeah, I would like to talk with you." And I was like, "Yeah." And then I believe Megan messaged me back again. And that's when it dawned on me. And I'm so grateful I had this aha moment for myself. And it dawned on me because I was like, something felt right. Something was getting me to shake. My body literally shakes when something is making me feel off and literally shake, I throw up. And so I start getting that. And I'm like, "What's going on, body? Tell me, speak to me, body." And what it dawned to me, it was Megan had no time for me when it was to connect about anything positive, any of my successes, nothing, not a like, not an acknowledgement. But when I was doing something wrong, that's when she had time for me. And I went, "Oh, this is not my person. This is not this is not a good human, not a good human in my life. No, absolutely not. So I just stopped. I just stopped replying in that for my
Mhm.
own sake. And then, ironically enough, this Megan person has become a bit of a bully to me on social media, which I was just like, what a turn of events, me adoring to this person being super mean to me. And I've had to uh, eliminate, unfriend. I think I blocked her. I hope I did. I must have because I don't remember seeing anything. But I had to go to that length because she only popped up to just try to find ways to insult me
Mhm.
on social media. A huge bummer. And I like to bring up this story because there's still going to be people who have a great experience and look up to her, and she's great too. It doesn't nullify or invalidate my experience, my awful,
Mhm.
terrible experience with this person. And it doesn't mean I'm any less of a person or in any, yeah. I mean, could she have had some thoughts that are valid? Absolutely. But she's not a person I would talk to about it. I'd rather
Mhm.
talk to somebody who's there for both sides of the conversation. And
Well,
that's
I think there's something, so like two things that come to mind as you're talking about this.
yeah,
One is this idea of the naysayers. And I think anytime you have somebody who is that person, it's always a tough thing, but especially when it's somebody in an area that you're passionate about, somebody that you look up to, there's that next level of connection to them, or like desire to connect with them, or that kind of thing. It's just that much more brutal when it's coming from somebody like that, and it's unfortunate, especially like within the dance medicine world. It's a small space. I mean, even thinking PT world, it seems like everybody knows everybody.
right.
But then we get into the dance world, and even thinking dance medicine, not just dance PT,
Mhm.
that's a super tiny group of people. And so it's like, when you have those interactions, it's unfortunate that we can't just help each other out and help lift one another up instead of
Yes,
having those moments, because there's more
exactly.
than enough to go around. It's something where we know that there is a lack of resources for the dance community, a lack of research compared to a lot of other areas of sports medicine and that kind of thing. And so it's like, why not all work together and support one another to help all of us out and our dance communities out more,
Yeah,
instead of trying to tear somebody else down? It's
exactly.
unfortunate.
And it's just, I mean, there are people who were in my class who have gone on and done similar things going into the dance PT world, and I have seen this bully support that. So it's just, it is personal and it's mean and it's hurtful. And like everybody has different ways to deal with things. I've learned when I need to speak up about it, especially if that person's in the room and I'm uncomfortable, I speak up about it because it's she's my bully. She's and unfortunately, like that's just what she's become at this point. And and it's, man, does it make you feel so small for no good reason. It's terrible.
Mhm.
It's
Mhm.
terrible. And it's unfortunate. I'm definitely not the only person. And I don't. And let's talk about where it makes zero sense to have any bullies in dance PT. We need more dance PTs and PTAs alone. We need more
Mhm.
dance medicine professionals. I remember when I was
Yes.
injured, I was a ballerina in California. There were no, and this was in the 80s, 90s, there were no dance medicine people. The closest I could get was in San Francisco. And there are people in San Francisco now. They did not exist back in my time.
Mhm.
So went there to this special sports medicine place, and I was put with some, I believe, guy that, like, he did not speak my language. We went there one time and that was it. We were out. I ended up doing Pilates. I ended up getting better, thank goodness. But I mean, Pilates people, wonderful. They don't know. I really look at it as some darn luck that I was able to get out of my, it was hip tendonitis, um,
Mhm.
to get out of that pain and fix my technique but like that was a longer road than it likely would have been had I had a dance medicine professional, especially physical
Yes.
therapist.
Yes.
So often there are posts online. Oh, do you know somebody in Arlington, Virginia. I feel like I just saw a Virginia post. Or wherever, or like, and there'll be crickets, or people will say people, it'll be the same person every time. That's one. It'll be someone that'll be the same person that's not close. It'll be people they think, are they in the area? They just tag them, but they're not sure, kind of thing. So this is an issue.
Yes.
Just because, and this is just true for everyone, just because, oh, I know a person in San Francisco, that's great. What if the dancer that goes there does not work well with that person? We need more people. We need more people. And when we're talking about going back to that naysaying, when we're talking about saying, oh, are you going to be accessible? Being out of network actually makes you way more accessible, because you have the opportunity to change the prices however you want, to move things around however you need to create packages however you can for this dancer to get the full help that they rightfully deserve, that they otherwise in many cases would not, because you're making the assumption that the dancer has insurance in the first place.
Yes. Yes. Assumption that the dancer has insurance. I know in Colorado, we have a really large HMO company that is here that a lot of people have, because it's known to have a pretty good reputation and, pretty reasonable prices when it comes to insurance and that kind of thing. But they definitely don't have any dance specialists within their network. And even the way that PT works there, I've heard very mixed reviews of people's experiences. And so, I've had a lot of patients who have that insurance end up coming to see me because they're like, no, we recognize that we need somebody who specializes in this, and we're willing to pay for it because we know we're not going to get what we need in what's available to us.
Exactly. And then for me, that's where I really, and any practice can do, that's where I develop my wellness programs to create group situations that are not physical therapy. So that the dancer has to be a certain point in their healing, so it's not physical therapy anymore. But those group things are such a good long-term getting them fully back to function solution. It's awesome. So awesome. Yeah. When you said Colorado,
yes,
I've always said Colorado.
There is a debate in the state.
This is
if it is Colorado or Colorado.
Colorado.
And there are people who, are from here who argue both ways. So nobody can decide on how it's actually said.
Okay.
I say it's Colorado.
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 I don't know why. I have to swallow to say it. Colorado. As soon as you said
British or something, it's fine.
Put in the comments. Put in the comments. Is it Colorado or Colorado? Colorado.
Right, exactly.
It feels weird when I say Colorado, though.
Oh, I love it. But yeah, I mean, there's so much to the whole, we need more dance specialists in general. Because I have a similar story. I was an injured high school dancer, and I went to my PCP, my primary care doc, and I hurt my knee, and he basically said, do some squats, take a leave, you should be fine. Even though my legs giving out on me on stairs, I wasn't dancing for 3 or 4 months. And eventually I got to a point where I could go back to dance, but I still was having problems with my knee. And it wasn't until I got to PT school and learned what was wrong with it and then what to do for it that anything changed. And so it's who knows? I never had any dreams of pursuing dance professionally, but I feel like at least the rest of my time in high school could have been a different experience if I had not been dealing with the knee issue at the time.
Yes.
And so, and even now, I still dance. I primarily do West Coast swing and compete in it. And there have been things where doing the hair whips and everything.
Yes, she does these great hair whips. You got to look up Alyssa dancing. It's very smooth.
Yes. But it's even things where I notice things that don't feel right in my body there's a lot that I'm able to go to that I use with my dancers who come see me, where it's like, maybe I should do this a little bit. And I was like, hey, look, it worked. It's great. And so it's fascinating getting to chat with some of my friends in the West Coast swing community who are sometimes younger than me, who were saying like, oh, my knees really bugging, my feet are bugging me, my whatever is bugging me. I don't know how you're dancing so much and blah, blah, blah. And it's like, if only you knew somebody who knows your dance style well and knows the human body and can maybe help you figure out how to not have these aches and pains and maybe improve technique or performance or endurance or who knows what. Like, who knows who that might be. But yeah, it's interesting seeing those people right next to me who are my friends having all of these things where their body doesn't feel like it's cooperating with them. And it's like, just come work with me and I can help you.
Right, right, right. And that's where we just need more. That's what aside from the fact that I love teaching people how to treat dancers, the need to have, even if, what makes you a dance med professional? Okay, so even if,
Mm.
so I'm gonna sidetrack. I love how I interrupt myself all the time. So the I had a conversation when I first started the Dance PT program. I'm doing all these phone calls. They're sales calls, 100%. And talking to one person, and she said, "Ooh, how do I become a Dance PT?" And I said, "Well," I said, what are you doing right now?" And she said, "Oh, I'm the main physical therapist for this ballet company." I said, "You are one." I was like, "You are one. What are you talking about? You are."
That's
She said,
awesome.
"Oh, I thought there was a thing that I had to." I'm like, no. And honestly, I would say the same thing now. Yes, you can get Dance PT certified, and it does look good because I do get like, yeah, I have the students at the backbone, sure. But do you need it to pursue? No, absolutely not. Like, I'm just the mentor that many people would want to have, and so I'm making that happen. So, but what makes you a Dance PT? Do you need to be doing it? Gosh, this one hair. Let's make it look beautiful. There we go. What makes you a Dance PT? You do not need to be. They don't have to be 100% of your practice. They
Right.
don't have to be 50%. It can be whatever you want to be. You could be in the middle of nowhere. I'm trying to think of a middle of the nowhere. Anyhow, a middle of nowhere place. And there's only one dance studio within an hour, but you're like the one PT. And so they come to you, they trickle in whenever it comes up, but you are the PT they go to. You're a dance PT. You don't have
Mhm.
to have a certain amount. I had one student after she worked with me, we were catching up the next year, and I was saying, how are things going, because things were really rough for her. She didn't get the job she wanted, where she wanted to do Dance PT, and because of the pandemic, and then she ended up getting to go back there, which was great. They ended up bringing her in. Wasn't rehiring because she was a student there first, but yeah, we
Mhm.
were finally able to hire her. And I said, "How are things going?" She said, "Well, I treat 50% dancer, then the rest is everything else." And she knew what I was going to ask before I could even say, "Are you happy? Are you good?" She said, "You know what? I would not want. I love this. I love getting to see all things. If it was 100% dancers, that would be too much for me." She said, "This is the perfect amount." I was like, "That's
Mhm.
fantastic."
Mhm.
She's happy doing that. It doesn't
Yeah.
have to be. There's some parents who have worked with me, and their dancers are at the studio they want to get in. That's the studio they work at, and they get the patients from. But now they know what to do. They didn't know.
Mhm.
And that was developing their skills. So it yeah, eh, yeah. That's it. That's it. It's like
Yeah, and
being an actor. If an actor doesn't book work, they're not an actor.
mhm. Yeah, and that's just it. I mean, like, even for me, my practice is not 100% dancers. It's grown percentage-wise over time, but it's not 100% dancers. And I think the biggest thing is it just needs to be somebody who understands where the dancer is coming from, understands some of the language, culture, expectations, movement needs, all of that kind of stuff, because dance is one of those sports and arts where we push our bodies beyond what is normal
Yes.
and beyond what it is maybe technically built to do. And so just, being able to say, yes, I can support you to get to your goals and not go, well, that's more than the human body's supposed to do. So, you know, you're good.
Yeah. Yeah.
No, that's not how this works.
It's not how it works. For talking about our practices, what we treat, I actually do treat mostly performers. I don't have many pedestrians, but I'm stubborn. I'm stubborn. So with that, and the reason why I say I'm stubborn, when I moved to Pittsburgh and I had to rebuild, I'm ready to. I'd rather do things I love to do than things I don't want to do. So for me, I
Mhm.
was definitely struggling financially. Alyssa knows. I was like, but the rebuilding has definitely happened, and which is great. I don't want a full schedule. That's why I can never get a student,
Mhm.
because I don't want a full schedule. I don't
Right.
want those hours. I don't want it. And also
Right.
that's what makes me capable to do the dance PT program, because Lord knows if I had a full schedule,
Oh, yeah.
no, thank you. And
Right.
then I do love my hands on doing a lot of other things. So I'm just not outside of physical, because I'm a performer still as well. So, and that definitely has helped continue to connect me with new performers and treating and all that stuff as well, which is great. So
Mhm.
that's how I want my life to be. So you can,
Right.
however you want to, be aware. Can I switch it? Can I switch gears? Is this cool?
Go for it.
All right. So let's talk about employment. So now be aware.
Yes. Yes.
I'm just talking with you. Just because I know your dance med spotlight might reach people and how this could help people. So that's why I'm just like, all right.
Mhm.
So now be aware when it comes to employment, as you're going, oh, do I want, there's 4 ways to work as a physical therapist. I'm not sure, a physical therapist assistant. I don't know other medical professions, but I'm sure there's overlap in what I'm about to say. 1, you can work for a place that's already established and has all the dancers coming in. You can good, you don't have to do anything. 2, you could go to a place where it's not established and you can do the work to bring in the dancers. 3, you can work for that place and then on your own, on the side, you could bring in dancers. If you are a physical therapist assistant, it cannot be physical therapy, as you know, because you have to have a PT connected, but it can be wellness.
Mhm.
Okay, so somebody who's not injured, but they want to achieve whatever goal. Okay, then lastly, starting your own thing with the PTA. Yes, it has to be with a physical therapist if you are doing formal physical therapy.
Mhm.
Okay, so those are the options. Now, when it comes to working for places, there are a lot of like places that are established. They pay horribly, horribly. And that's me saying it nicely. Alyssa knows it's so bad. It doesn't mean, oh, just because you want to work with dancers doesn't mean you have to be paid less. And that does lead to burnout. These
Mhm.
places that pay horribly, pay attention to the turnaround. Uh, how long are people working there? Like think of how long that place has been in existence, and then also look at the age of the people. If everyone there is young, that's not a good thing. That's saying why don't we have people staying there for a long time? You want people of all ages. Oh gosh, I just got hair in my eyelash. So I'll give examples of good places where I've seen all ages. Because definitely, if I have something positive to say, Harkness has all ages. I'm focusing on New York because I know New York. And
Mhm.
then, oh God, what's the one that's right by American Ballet Theater? Um,
I
oh,
don't know New York, so I can't help you.
this is like my language, and I'm thinking, oh, and I know if they ever listen to this, they'll be like, we know who you're talking about. That's us. And we're like, yes. Um, uh, 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 I don't want to say names in case I don't say them, but there's a girl who works there, and she does teaches and helps people with treating dancers as well.
Are you thinking, is it West End
Yes, West Side
PT
Dance.
or
West
West
Side
Side?
Dance
Mhm.
Physical Therapy. They also have people of all ages working there for a long time. And if you're lucky, you get there when somebody is leaving. And they're usually leaving to like start their own thing, or just change it up. But it's not because they're like, because it's clearly a solid place to work. Both,
Mhm.
both of these places. For me, I knew. I wanted to start my own business from doing a business course while I was in my final year. I also, for me, part of my checklist when I work at a place, I need to be able to be myself. And so if I have to put on that khaki pants polo shirt personality, I can no thank you. Can
Mhm.
I? Sure, I've done it. But I'm just
Mhm.
at a point in my life, I'm at an age where I'm good. I don't,
Right.
nah, I don't
Right.
want it. So that is a big thing. And also, I don't want to be treating, yes, or there are some exceptions, but I don't want to be treating a show at night, backstage care regularly. Sure, like a couple one offs, sure, but not regularly because I want to perform.
Mhm.
So I'm good. Like, I'm good.
Mhm.
But
Yep.
however, I've definitely treated performers in shows that I've been in. So, whatever.
Yeah.
But anywho's, yeah, so that's a real journey. I wanted to mention that the pay and everything, those are things to be thinking about. The schedule, still looking at the schedule.
Mhm.
I also don't like places that it's not all of them, but I don't in any place, even outside of Dance PT, I think it is an alarm if a physical therapy clinic is saying, we're the only ones who do this. You cannot get this anywhere else. We're the best. We're the only ones. Because you think that dancers going to live in New York for the rest of their life? What if they go and move to freaking Arizona or Ohio or
Mhm.
California or somewhere where you don't have a clinic? So now they think they are never going to get good treatment for the rest of their life. And we know that's not true. We know that's
Mhm.
100% not true.
Mhm.
So I think that rhetoric needs to just stop because that's actually going against the long-term healing for those dancers. And then it also makes the dancer feel if they are not feeling like the treatment's working out for them where they're at, because you're saying, hey, we're the best, then they think they're stuck with their problem forever.
Right. Yeah, I think those are really important points. And one thing that I wanna go back to that you mentioned that I think is really important, thinking of the PTs or PTAs, students, etcetera, it's important to remember, and this is one of my soapboxes that I will be on forever. It is important to remember that physical therapy doesn't need to look like any one thing. We've already talked plenty about the whole, like, khaki polo shirt personality PT, but what work looks like also doesn't need to look like any one thing. And so, if you're at a point, whether it's while you're still in school and you're kind of looking at job prospects, or you're already a PT and you're feeling burnt out, I think it's so important to kind of go back to some of those things and think about what is it that you really want out of your career? Are the jobs that you're looking at supporting some of those things for you? So, like for you, you don't want to regularly do evening shows, weekend shows because you also want to be able to perform.
Mhm.
For
Or
me,
go in the
I
pool
love
at
right.
night. It's a hot day.
Right. There you go. And, like, for me, I love teaching, and so, I want something where it allows me to still work with students and do that side of things. I like doing backstage and event things. Granted, I don't do that on a regular basis, but, that's something that I enjoy doing, and so having a schedule that allows me to be flexible, to be able to work events, even if it's like my West Coast swing conventions where I'm there for 3 days over the weekend. I want to be able to support all of those different things. I love going to conferences. I love being able to go speak at studios. And so, with the way that my practice is built, if you look at just my practice alone, it doesn't look that impressive. It's not a high number of patients that I have on caseload. I'm not working a ton of hours in the clinic every week. It's not my primary source of income either, but it is supporting what I love doing,
Yes.
working with the people that I love, and help support the life that I want for myself so that I still can be out dancing. I still can compete. I still can teach. I can still do all of those other things that help fill my cup and drive my passion in what I do. And so, when you're in those places where you're like, oh, what am I even going to do? Because I don't want to do the typical PT thing, look for options. And it could be you find something that is, as an employee somewhere, that really fits what you're wanting. Fantastic. Maybe it's something where you go out on your own. Whatever. There are options.
Yeah. There are options. Exactly. There are options. It's not just one thing. I love that.
Yeah.
Yes. That's a
Yeah.
beautiful soapbox. I think you should decorate it. Oh my God, we should make soapboxes, like portable
Oh
ones.
my gosh.
And so then, like,
I
if
have a
we
box for soap
are you serious?
here.
But wouldn't
Mhm.
that be funny? Is to like bring that at a conference and you're like, wait a second, and you pull out the soapbox and you stand. So this actually makes me think, oh my God, you're not even trying to be dramatic, but wouldn't that be hilarious?
Mhm.
This should happen. This should be a thing.
And I feel like it needs to involve like puff paint and glitter and
Yes,
rhinestones and all
absolutely.
the things.
Yes, very Selena, the singer, how she did the rhinestones, that look,
Mhm.
absolutely.
Mhm.
And you could even maybe, put some sort of electric horn or bell, so when you're done with your soapbox, you click that so people know and signals you're done, you're getting off your soapbox.
Like, all right, you can continue. Thank you.
It could be like it could be an automatic thing that says, "And that concludes the diatribe," or whatever.
Yes. Yes.
Oh, yes, I love that so much.
So now I want to transition to give you a chance to talk more specifically about your dance PT program. So for people who have not seen information about it, are not familiar with it, give us a little spiel of what this is and who
Okay.
it's for.
So if you want to look at the website, it's danceptprogram.com. This is danceptprogram.com. This is for physical therapists and physical therapist assistants. Now, I know all medical professionals listen to this podcast. It's not a no forever with other medical professionals. It's just everything I'm teaching is based off of the assumption and the limitation of what I know. So I'm going to assume you know things, and that's my starting point when working with students and professionals in physical therapy. Even students, I know they're about to learn it, so I know what I talk about is going to line up and not blah, 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 blah. I also don't need to worry about the legalities of teaching things that is not within scope and vice versa. Like it's that whole, as we all know in the medical profession, this is not a new thing of like, is that in your scope? We're always asking that of ourselves and what among in them with our friends in the profession.
Yes.
So in this, it's a eight, okay. It's an 8-week long program. It is all virtual. It teaches you how to treat dancers and to get them in the door. There are 2 tracks when you go on the website as a student. There's a treatment track and the business track. You have access to both of them forever. So if I add anything, you automatically get it. A great example is in 2020, when I first started doing the program, I did not have CEUs or a certification. So all the alumni automatically get access to all the lessons and everything and the assignments and quizzes to still get those CEUs. Does not matter the price that they got the Dance PT program at. In this program, in regards to mentorship, you have a 30-minute one-on-one call with me per week for 8 weeks, and then a group call that's an hour-long max per week on Mondays at 9 p.m. Eastern time. If you cannot make it to that Monday 9 p.m. Eastern Zoom call, don't worry, it's recorded. You have access to it forever. Everything is, since you have access to it forever in regards to time. I work with all different schedules because I've had a lot of parents, I have a lot of people with busy, unpredictable schedules and events in their life, weddings, NPTE, exams, just working at a mill like Alyssa did back in the day kind of situation. I don't even know when I can sleep kind of thing. You have access to it forever to let you work on your own time. And in there, in regards to treatment, I teach you how to treat all different styles of dance. I really focus on not the acute part where, oh, they just had a surgery. The surgery forever. I have something in my eye, so I'm going to just keep playing. Also, I just look so beautiful when I work on my eyelashes. The what the heck was I saying?
Not acute, not so much the
Not
acute.
acute. Yeah.
Mhm.
So acute is the same for anyone. You don't have to be a dancer. Like once you're recovering from an injury, it's still the same, essentially the same protocol, maybe some some slight differentiations depending on what doctor you're working with and stuff. But that's I focus on when the dancer would be discharged from doing sideline clamshells, engaging your deep core muscles. Like, we're moving on. We've done that. We are beyond that. Can, of course, you include that in the thought process? Sure. But where I focus on is where we start doing higher level functional exercises and self manual, self joint mobilizations, using their own body weight to get to whatever goal you ultimately needed to get to in the first place, to be performing at that highest level, and then also to achieve that is. And I throw different things at you so you feel comfortable with anything that comes in your door, anything you want to try to do, because your brain is working that way. I get you to build your toolbox, to be absolutely unafraid and fearless, to keep grabbing things. And I just really get your brain to work beyond that basic part. A very common issue people have is how to what exercises to use, how to keep expanding that toolbox. So I get you really, really good at that. Regarding manual, it's virtual. I'm not going to focus on manual. And then also, from my experience, the long-term results have come from exercise. So I have a bias and a lean that way. Also, it doesn't make sense to do manual virtual. Did I mention that already? So you can do there's a lot of great manual therapy programs. Go do those. Those are awesome. So we're focusing on all that functional stuff where the dancer can independently do things. In regards to marketing, I have a very, very organized, very like Excel spreadsheet system that you create, that you just literally, once it's all put together, which that takes time with my guidance, then you just literally use it in the way that I teach you to use it. And it works. Mm-hmm. It works. So yeah, I love this Dance PT program. It's really where you get that wonderful extra kick in your butt to get the job done. And it's not easy. None of it is easy. None of it happens overnight. And that's why I'm there to help you, because sure, you can look things up on YouTube. You can get intermittent lessons, but for you to be confident that you are like good to go, that's the Dance PT program. And that still, all the other dance, physical therapy, continuing education courses, they're awesome. Mine is that through line. Mm-hmm. Mine is that through line for you to just be like, I'm good. And you'll end up doing it's because we always have to learn, like literally legally, and also we want to. So from mine, yeah, you go and learn from all these other places. I'm extremely evidence-based. When people are like, where's your evidence? I literally have a library because I keep collecting my references. So there's a lot of evidence that I use for this because I have to keep staying on top of it. And also with what you were saying before, Alyssa, made me think of the research. Our research is still so piss poor that I need to stay on top of anything that we have that's long-term results. For instance, I get very into, when we are discussing how to get that dancer back to whatever that full function is, I get very into, my brain just absolutely like, I think it's gone. It might be gone. Anybody who's of a certain age relates with me right now, hardcore. Yeah, it's gone. It's gone.
It may come back. That's cool. So, is there anyone who is maybe not the right fit for your program, at least right now?
Anyone who's not a physical therapist or physical therapist assistant. There may be a bleed over with athletic trainers. There is a lot more. I have friends who were athletic trainers and then became physical therapists, and they were like, there's so much more that PTs know. So I just legally, I start to, so I'm going to take back what I just said, because I feel rude when I say that, not for, because ATCs are freaking awesome. I have friends who are killing it out there and helping dancers. But for me, because of my limited expertise is really focused on physical therapists and physical therapist assistants, I feel comfortable not only with my expertise, but also I would say legally comfortable keeping my focus there, just because I just don't want to mess up. And I am the queen of messing up. I made so many mistakes in my life, but that's why I'm so good at the things I'm good at. And I will continue to make mistakes. It's fine. We all do. And then I'll just keep learning and growing and being great.
Yes, exactly. And I can tell you, just from knowing Jenna and having a lot of conversations over the years about all sorts of things. But related to the Dance PT program, if it's something where you're kind of thinking, this sounds interesting, I don't know if it's the right fit for me, I don't know if it's the right time for me, she's fantastic about getting on the phone and having a conversation with you, asking you questions and seeing if, if now is the right time, if maybe the next go around may be a better time for you. But, helping you figure out when and how to get involved in it. So like if you're on the fence, if you're not sure, reach out to her and she will help you figure things out.
Yeah, join the Dance Physical Therapist Facebook group. That's a wonderful group. I hold 4 free virtual summits a year where it's free lessons on how to treat. And it includes treatment and marketing, and sometimes conversations on how for you to get out of your head. For instance, one we have coming up, which probably by the time this is published will have already happened, will be an Oxford debate based on research on manual therapy versus exercises.
Mhm.
So yeah. Oh yeah, I think that's what I was getting into. I'm going to go back, rewind. I was talking about research. I believe it essentially had to do with that, because the research, we need research on anything, and we're still lacking. It's important for me to stay on top of it because I would treat dancers. There was one research article off the top of my head that came out, and I was having a debate with a student, and because I get very into motivation versus evidence-based, because you have to consider both. And
Mhm.
one was saying, oh, instead of holding a stretch for 30 seconds, it was 3 sets of 30 seconds. And I said, that's great. That's only one study that's seeing better results. I said, but is this great long-term? Because that is a long time for any habit that we are forming, for our exercises that we're doing. That is a growingly frustrating habit to stick to.
Mhm.
If you're doing 3 sets of 30 seconds for all the body parts you need to keep mobile that tend to be hypomobile compared to the areas that tend to be hypermobile in a dancer, that's a big commitment for long term. So I love having that evidence there, but that then to assess functionally with the areas that we're missing still, to know the questions I still need to have answered, aka motivation. So I'm just always staying on top of that research, and I have that database for any of the people who do the program, so you can just look things up. I've had students use that for presentations to save themselves time to go through
Mhm.
and be like, okay, let's see what we got for hip labral tears, or and so on.
Yeah.
Yeah.
So I think this is a fantastic point to introduce a special segment that we have on the show. So this is the final bow. Basically, your parting words for the audience. If they leave learning nothing else, what is your big take home message for them?
First of all, I love that little point you made. That brought me so much joy. I almost like get giddy and like jump up and down from that. My take home message still has not changed. Be yourself. Be yourself first. Be yourself in at home. Be yourself at your workplace. Be connected with who you are, what you like, what doesn't fly for you, where your boundaries need to be. The humans that help you excel the most and feel the best about yourself, surrounding yourself with those people. The humans who not only are that, but believe in you, surrounding yourself with those people, just continuing to connect with who you are and what makes you just the most joyous, and then create those surroundings to best be authentically who you are. There is no other way to live. There is no other way to live. You can fake it, but it's just miserable. I was just watching a documentary about Wham, this old
Mm,
group, and
yes.
George Michael, forever, because of his career, all these women were lusting after him. He hid the fact that he was gay for the longest time. He had to hide a big part of who he was. And it was very difficult. It was a big trade-off for him for a very long time. I say from the
Mhm.
get-go, be 100% who you are. So that way you don't have to negotiate terms for you to be you. That's
Yes.
outrageous. Who you are is great. There's a girl, Elise Myers, on TikTok, who I enjoy very much, and she has this T-shirt she wears that says "Go find less."
Hmm.
You are a person, or if you're a person who's introverted, imagine it say, go find more. If you don't work for a person, that's great. Now you both know. Move on. Do you know how many people there are in this world? Do you know how many dancers there are in this world? And yes, the dance medical world is small, but it only takes one person to start looking for certain people for a whole other like niche of humans to just evolve. There are so many people in the dance PTA world who are like me, where at first I thought, oh, no, they were just all hiding and feeling ashamed about who they were. So be yourself first, so that way you can just honestly be your happiest. Be your happiest.
Last thing, this is your opportunity for your shameless plug. So anything that you want to share that you have going on that you want to promote to the audience, this is your chance.
One, if you have not gone to Disneyland or Disney World, you must go. If you can't see and you're just listening, I have a whole Tangled Castle in the background. Disney is joy. I make zero money from doing this. One day, my dream is to somehow be in partnership with Disney, have unlimited passes and unlimited hotel stay at all the Disney hotels all around the world. Okay,
Yes.
so that was the first shameless plug that I don't really benefit from unless Disney decides to like sponsor me. Disney, that would be great. You already said the Dance PT program. I don't think I have anything else other than, let's see. Oh, I would just say just join the Dance Physical Therapist Facebook group, because if you just need free stuff right now, I'm not going to give everything free, but if you want free stuff, there is a lot with the summits, and everybody loves those when you can make it to them. And if the replays are only $25, and if I choose to ever bring up the price, that's fine. $25 like is so insanely a rip off. And I literally use that to cover the cost for just advertising the darn thing. But, yeah, I would just recommend that, and Dance PT. Oh, I do have a podcast, Dance Physical Therapist podcast. But it's not really my primary thing. I really just focus very differently than Alyssa. I focus on getting out of your way, burnout. A lot of that stuff is more of where I put my energy there. So proud of Alyssa for doing this podcast. This had better be huge, otherwise I'm gonna be mad at whatever.
Appreciate it.
Yeah, I'm so happy about this. I remember when those first came out. It's great. Okay, I'm sidetracking as usual. It was a joy, everyone.
Yes, thanks for being a guest today. Dance Med Spotlight is hosted and produced by Alyssa Arms. We discuss all things dance medicine. This has been another episode from Dance Med Spotlight. The Dance Med Spotlight is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present.